John Shinholzer.
Yeah.
Hi.
Good evening, Mr. Mayor. Thank you for having me here. My name's John Shinholzer. I'm a advocacy director for American Veterans for Kratom Safe. And I'm also a United States Marine Corps veteran. I served 4 years in the infantry, deployed 3 times. I was a paint contractor and wallpaper hanger for 30 years. In the last 20 years, I developed, me and my wife were founders of Virginia's leading authentic peer recovery community center. It turned out to be a national model. It's mirrored all across America. And in August 1982, I got sober in the Marine Corps. So I celebrated 43 years in recovery this past August. So
Hell yeah, John.
got a lot of experience with addiction and recovery and chronic pain and whatnot. But about 12 years ago, 14 years ago in our recovery center, we noticed Kratom popping up on our drug test. I didn't know anything about it. Long story short, I've actually studied it for the last 12 years. I have some of the 600 scientific studies with me tonight. They're summaries, over 100 peer reviewed. But 12, 14 years ago, the Kratom we saw then is not the Kratom you got today. Well, you know, you guys you got a bill on the table. I think it's really important, and I'm supporting the bill 100%. I just got one little exception there. Natural Kratom leaf products, the genuine tea and the natural products, you know, I see that as a win, you know, not only for the 50 million Americans that are underserved with the chronic pain, but in the addiction world. We noticed a lot of addicts were pivoting from the one pill kills to a leaf product, and it solved their problems. And a lot of alcoholics and meth addicts and crack addicts and prescription addicts, they have a tendency to pivot to the natural leaf Kratom products. Mm-hmm. And to put it in comparison of what I'm supporting, you wanting to ban those 7-OH products, the adulterated products, the synthesized products, it's like a near beer compared to a fifth of 200 proof alcohol. The disparity is incredible. And to ban Kratom products, the natural leaf products, and what that does, it cuts off a lifeline for a lot of people. You don't even know are consuming it. And, you know, 2 years ago, I participated in Johns Hopkins human clinical trials. You know, I was curious about this product because of my pain situation. I'm only one of my family out of 10 that doesn't have one or more hip and joint replacement. I got that bad gene there. But, you know, I took a gram 4 times a day for 9 months. It took away all my pain. It you know, gave me higher energy and good focus. And then I went cold turkey overnight with Johns Hopkins, and I really didn't have any detox problems or any problems not taking it. You know, for the next 60 days, you know, the first couple of nights I didn't sleep good, but other than that, it was fine. Now, like I said, for me to stop taking a gram when the abuse that people are doing, it's like equivalent to 200-300 grams a day, you know. So like I'm saying, the 7-OH products, the adulterated products, the synthesized products, they're terrible. I don't want them in my community. I'm getting them out of my community. Virginia passed the Kratom Consumer Protection Act, so we don't have quite as bad a problem you got here. And so I'm asking you, the city council, to maybe have an amendment with the bill you want to pass, the whatever you call it, the resolution, and just, you know, exempt natural Kratom products. Mm-hmm. They are safe. The FDA knows they're safe. They would have banned them in 2016, but they couldn't because they passed in 1994 the Shea Act, which meant they could pass the 8-factor analysis test. And the products I'm talking about use FDA, GMP regulatory packaging processes. So they got the proper labels, the warnings, and there's a way to do that because many communities in many states are doing that as we speak. You got a bill coming up at your capital, and they're working through a process how to regulate it. Regulation is the key here instead of just an outright ban. And should you have further discussion when you get to that, I'll hang out in case a question might come up because, you know, are you looking for a solution to a workaround? But I'm just asking y'all to give pause to just outright banning the natural Kratom products. But you're directly wanting to ban the bad ones. Mm-hmm. That's the simple, short discussion.
Okay, thank you very much.
You're welcome. Any questions? All right, thank you. Left you this is the mayor's packet right here.
Okay, just leave it right there.
Boy, he'd just be going everywhere.
Mm-hmm.
Jennifer Johns.
It's another Jennifer.
I'm telling this year.
JJ.
Hello. Jennifer Johns. I own Simply JJ on the square.
I am Tim Heck, own Bracken Company.
So both of us are located in what he calls the West Washington corridor, where we have full up of businesses, which is great. But an issue that has kind of become something lately is there's nowhere for us to unload product. And I got, like today, for instance, FedEx brought 9 boxes. It was a Monday, it's not busy up there, it's not a big deal. But on like a Thursday or a Friday, when they're bringing a lot of shipments, and it's not just me, I mean, he gets orders. Kayla McConkey is now there with KJ and Co. There's nowhere for people, like the trucks, to park safely. So they're looping around the block repeatedly. So I'm just wondering about the possibility of a loading zone that would serve like our block, really the block that goes like with the 3 Ravens. It could go, you know, like it could fit a lot of people basically. So my idea is right in front of my store, there's one parking place, and FedEx actually pulled up into that spot. And I've got pictures of it and I failed to bring them. But that would show, like, basically it would give them the space to pull safely. They're not blocking cars in, they're not blocking the roads that people can't get through, because it's a problem. And I know they're frustrated because they have to go around and around and around in order to find some place to kind of just pull over most days. So not only that, but we also bring, I know Kayla brings items from her home. She's having shipments brought there. I have stuff delivered to my house if I'm not going to be at the shop to get them. So for our purposes, to be able to have somewhere safely to pull, because right now I'm pulling like in the crosswalk and it's, you know, it's not safe. So I don't know what the protocol is as far as like to have that considered as a possibility, just for delivery purposes.
That's it?
That's it.
Thank you. Tim?
On a similar note, just in terms of the parking, I'm wondering if there's a possibility of somehow doing a validation for people. Is a 2-hour parking restriction on the square in every block, you know, leading off, which I understand why that's in effect. But we have probably 70% of our business is people from out of town. So if somebody's coming from out of town and is having, for example, a hair appointment on our block and then going to.
I had my damn mic muted.
That's not a 2-hour.
I said I have my my
that
phone
have
leaning on the
received
computer,
tickets,
so I don't
have
have to hold
walked
2
into
phones.
stores,
I've got mine like
understandably
right
upset.
behind my
They're visiting from surrounding
laptop,
communities,
dude.
supporting
I
our
was like
businesses,
completely
and,
just
you know, they get a parking ticket. So I understand why that's in effect.
say I got
Wonder if
20
there's
things
a
going on
way
in
of
my
doing
head.
validation where if they have been in your business and it extends, that somehow they could leave the ticket with one of the shop
I'm just
owners
gonna
or
read
business
mine.
owners,
I
and
feel
we
like I
can
do better
then
that way.
somehow
Me too.
stamp that or put some kind of thing in there where we could potentially take it off their hands and say, we'll take care of that, and then get that to the person at hand. But, you know, we've got 3 salons on the street. I don't have my hair done, clearly. But I think those processes take sometimes a while, hour and a half, and then you want to shop and eat. And also people will come into a store and pick up something and put it in their car and then continue shopping. And yes, they can potentially park 2 or 3 blocks off the square, but that's not as convenient as parking on the square. So I'm just asking if there's a possibility of doing some kind of validation, so we're not upsetting our patrons. Again, well over half of our customers are out of town people. So they're making a trek, whether it be from Bloomington, Arthur, wherever, Tuscola, to shop and support our businesses. And if that happens, it's not the best PR for our town and business to hand them a $10 parking ticket for supporting our businesses. So I'm not sure who that goes to. We'd be happy to kind of organize it from our end if there's a person that's kind of in charge of that.
Okay, thank you. Remote participation. This is an opportunity for the public to provide public comment to the presiding officer. The public comments must comply with ordinance 2014-02 and be limited to 5 minutes or less. At this time, members of the public are able to attend public meetings by web conference and to submit public comment by email, voicemail, or through web conference. Okay, Mike?
Yes, Mike Pisano.
Ooh.
Yes, this is him speaking. I'll share my camera if you want me to. Um,
There's Mike.
Sorry. So I've been a Kratom consumer for 15 years. I only drink the natural plain leaf, just the regular tea. I'm a healthy young man. I use it helps me with my chronic insomnia. It helps me with my joint pains. I'm going to be turning 40 tomorrow. Um, so I wanted to share my experience with it. That my blood works great. I'm healthy mentally, physically. Um, and I agree with the others like John that I do support regulation and age restriction. And I really, really would like the state of Illinois to pass the Creative Consumer Protection Act. I think there's several bills that are currently in legislation. I think those are solid bills. And I'm really, anxious and really would like to see legislation passed for that and something within the villages if possible. I don't have much knowledge, experience about the science or regulation and whatnot, but I want to share my experience as a personal testimony consumer that it's really helped me with my insomnia for a very long time. And like I said before, I'm healthy and I'm very grateful for it. And thank you for this opportunity to let me speak.
Yay, Mike.
Thank you very much. Melody?
Hi, thank you for letting me speak. I am an 11-year daily Kratom consumer, and I take it for pain relief. I used to be using a walker and even a wheelchair at times. I could run events like the zoo and so forth. But Kratom, I've got my mobility back. I'm still in pain right now, but it's manageable. And back in July 28th, I believe it was 28th, HHS and the FDA, they asked me, an 11-year daily consumer, to talk about its benefits, not its adverse effects, but its benefits. And they wanted me to distinguish it, that what's helping me is Kratom and 7-OH is not Kratom. And so I would just like you to take that into consideration tonight. There are, like John said, 50 million underserved chronic pain patients, and I'm one of them. And thankfully, because of Kratom, I was able to provide my family in 2022 for a full year of childcare because my daughter's childcare facility closed down 2 weeks before she went off maternity leave. So I was able to save a young family $50,000. And in today's economy, that's a lot of money. I just did the same thing again this summer. I provided childcare for my 3.5-year-old granddaughter. I spent the days at splash pads, actually rolling down hills with her and swinging. And without Kratom, I wouldn't hardly know my granddaughter. I would be bedridden. So I'm just asking you to take that into consideration. Get rid of the 7-OH. The FDA and HHS have been very clear. They are not targeting it. And if they were, would they ask an 11-year daily consumer to come up on their platform at a national press briefing and talk
I still
about the
think that's
benefit?
cool.
So I just like you to target the 7-OH and leave unadulterated
But that's
products
true, though.
available for
Yeah.
consumers like myself. Thank you.
Thank you very much. Misty Brown?
Hi, can you guys hear me okay?
Yep.
Okay. My name is Misty Brown, and I'm a Kratom consumer, advocate, and activist from Colorado. I would like to read y'all my testimony. I was addicted to FDA-approved pain pills, benzos, and muscle relaxers for 11 years straight via chronic pain management. for my degenerative disc disease from 2008 to 2019. I got fired from chronic pain management in April 2019 because I didn't show up for a per contract pill count. I was 11 pills short and my drug dealers didn't have any pink Oxy 10s. After that, I went to the streets and I started doing cocaine while I was searching for a new pain management doctor. In June of 2019, while in cocaine withdrawal, I watched that documentary, A Leaf of Faith. My journey with whole leaf kratom began the very next day. Whole leaf kratom shut that I need one more snort, one more pill, one more escape noise off in my brain. It allowed me to work on my whys of addiction. I have not been back to pain management in over 6.5 years. I'm a functioning member of society again. I'm a thriving mother again. I pay taxes again. I am no longer a burden to my kids, and I am now a first-time grandma. I will be forever grateful and thankful that I accidentally found lab-tested whole leaf kratom powder. You guys have to know how to differentiate between
Killed it.
synthetic 7-OH and whole leaf kratom. So I mirror what John and Melody and Mike say, regulation. We need regulation. Do what you wish with the synthetic 7-OH products, but don't lump that into the natural kratom leaf. Thank you for your time.
Thank you.
Killed it.
Allison Smith.
Nice. Killed it, Misty.
I had to take my headphones off.
Yeah, that's why I keep on
Can't
taking
hear
mine
you.
on and off because I know it's gonna get to
Are
me.
you
Could you
muted?
hear me still?
Yeah.
Okay.
Hey, can you guys hear me now?
Yes.
Okay, perfect. Good evening, Mayor Stoner and members of the council. My name is Allison Smith, and I am the Director of Government Affairs for the Global Kratom Coalition. We are an alliance of consumers, scientific
Dude, she looks
experts,
up
and
her
industry leaders
Oh,
who
God.
I've
seek
never
to
seen her.
enact regulation that ensure consumers have access to safe and regulated natural kratom products. Our mission is to advance scientific research, engage consumer education, and serve as a resource for stakeholders and decision makers in legislative and regulatory matters. The GKC respectfully opposes Ordinance 2025-67 as it is drafted because of its blanket ban on all kratom, including natural leaf. Natural kratom leaf is a botanical substance from Southeast Asia with centuries of safe traditional use that's grown in popularity in the recent years. Today, there are approximately 23 million people in the United States reporting consumption of natural kratom leaf for its functional benefits. With at least 50 years of use in the United States, there are decades of science supporting its safe use, including an FDA single ascending dose clinical trial,
She's covering the
which
science.
demonstrated that natural kratom leaf is highly tolerable in humans, even at high servings. And this is why we oppose the outright ban on natural kratom leaf. Instead, we recommend taking the same approach as the FDA. For those who may not be aware, on July 29th of 2025, the HHS, the FDA, and the DEA announced a coordinated federal action to schedule concentrated synthetic 7-OH, Schedule 1 controlled substance. For context, 7-OH is an oxidative byproduct found in trace amounts in dried kratom leaf. However, concentrated 7-OH is synthetically are synthetically enhanced and are 100 times more potent than natural kratom leaf and are 13 times more potent than morphine.
Wow.
Crucially, the FDA made it very clear that their recommendation only applies to products containing concentrated and unnatural levels of 7-OH, not products that contain natural kratom leaf. And since making that announcement, at the FDA, Commissioner Dr. Marty McCary has made clear in numerous interviews and press conferences that the federal government is not targeting natural kratom leaf, and their concern lies with the concentrated synthetic 7-OH products. Further evidence of this distinction at the state level is the FDA commissioner and the Attorney General of Florida announced recently that Florida would be adding concentrated synthetic 7-OH to its Controlled Substances Act by using an emergency rulemaking. And again, in that situation, it was made clear that natural leaf kratom would not be included in the scheduling. So we come to you to suggest that rather than a blanket ban on natural kratom products, a more appropriate method would be to follow the FDA's lead and enact a prohibition against concentrated synthetic 7-OH while simultaneously enacting common sense regulations such as an age requirement, such as age requirements on kratom leaf products. There's a plethora of evidence on the safety of natural leaf products. It's the concentrated synthetic 7-OH that is known to be dangerous and should be the focus of this ban. I thank you all for your concern for the residents of Monticello, and I welcome the opportunity to bring any additional scientific studies, factual reports, and kratom experts to your attention in order to aid in the decision making. We, the GKC, we look forward to serving as a resource in the near and long term. Thank you.
Thank you.
She
Jennifer
did it.
Gillis? We can't hear you. You're muted. No. Yes, maybe. No. I have the same issues. Don't worry about it. No. There you go. No. Usually a microphone, isn't it?
Press the volume button.
You try turning the volume up?
Man.
Is there a picture of a microphone there somewhere that has a line through it?
Call in.
Call in.
Wish I could help you.
Big camera.
Someone's like, hey.
Something that went away. I don't know what happened.
Okay, so she's gonna go out and come back
She's going to go out and come back, okay. Just chat, it's okay.
Oh, you probably were Bluetooth in.
Can you hear me now?
Yes.
Oh, there we go.
Oh, thank goodness. I'm so glad that I apologize. I'm so sorry. Technology hates me sometimes. Thank you so much for your patience. I do appreciate it. Um, my name is Jennifer Gillis, and I have been a Kratom consumer and advocate for the past 6 years. And I just want to share a little bit of my story on the impact that Kratom's had on my life. 19 years ago, I was diagnosed with transverse myelitis, and this came not only with a lot of physical limitations, but I also became a lifelong chronic pain patient. For 13 years, I utilized various pain management options, including prescription medications, to help me be able to function in life. But due to circumstances like DEA cutbacks and the ever-changing regulations, I was eventually unable to get my pain medications that I relied upon for so long. In May of 2019, I found whole leaf Kratom, and I have been a responsible Kratom consumer for the last 6 years. I can get out of bed, run errands, attend school functions, and I just feel like I live somewhat of a normal life, even though I still have physical limitations. I know there are a lot of others like me who have a similar story, and Kratom is just a lifeline for people like me. I do absolutely support regulations like age requirements, lab testing, labeling. Additionally, I'd like to see more education on the difference between natural whole leaf Kratom versus the semi-synthetic 7-OH products that are being marketed as Kratom out in the market now. It is good to see the FDA has kind of stepped in and is not only trying to educate the public, but warn about the risks of the 7-OH products. I'm glad that they've also made the distinction and that their concern is not with the whole leaf Kratom. But again, thank you so much. I appreciate your time. Thank you for allowing me to speak tonight, and thank you for being patient with me.
Thank you very much. Steve Schreffler.
Good evening. Until this morning, I'd never heard of Kratom before, so I'm not aware that we've got a real problem in Monticello, and especially one that needs to be acted on without
that was
good
crazy.
due diligence before.
Did you
I know
see
it's
all
never
I
been
had to
discussed
do?
in an open city council meeting before, so I would
Dude, I was like going to
caution
my
you to
settings and all
proceed
kinds of stuff.
with
I'm like, what?
wisdom on this.
Hold on.
I think you were
The
Bluetooth in the whole time.
Yeah,
I would
well,
like
my
to bring to
Bluetooth,
the
like,
city
I ended up
council's
just like
attention
leaving and
the
then like
debates
resetting my
and the
Bluetooth and it
result
worked.
of the solar farm that was
But I'm
proposed
like,
at the
he
middle
kept on acting
school.
like he could kind of hear me.
Sounds to
I was
me
like,
like
well, can you hear
the
me?
current
No,
proposal is very
couldn't hear
similar
you.
in its
At least they were
close
nice about it,
proximity
you know?
to
I know.
residential
Sometimes they're like, you know, you just
properties.
have to come back.
And
You know?
I was a little bit
Yeah, that
dismayed
was
at
not
the
cool.
You did
zoning planning
amazing.
commission in that they were not interested in gathering information.
I should have been
As
like,
you
well, you know,
know,
my
they're an
AC
advisory
quit working
body
today too, so it might as
that
well be my phone.
that you count on to take the testimony, examine witnesses, and evaluate information when they go to make their recommendation to you. And in this case, the chairman was very clear that he wasn't interested in learning anything more about the information that was being presented, and that seemed nearsighted to me. And I commented on that. I don't know if it's in their minutes or not. But I would both of these things I would consider that none of them are emergencies that you need to move on before you are fully informed, so where you can make good informed decisions. And I guess that's all I had to say. Just it seems like these things are getting fast tracked through, and I'm not aware that we have a situation in Monticello with either one of these that has to be done without due diligence and prudence in your decision making. That's all. Thank you.
Thank you. Laura Romney.
Laura.
That guy didn't know what Kratom was, so he was. I forgot exactly what he said, but
Okay.
I should have shut
I'm
up.
coming on. There we go.
Can hear you.
Great. Oh, that's good news. Hey, thanks for
Yeah.
allowing me to speak tonight. I'm going between computer and phone because my computer wouldn't let me. So I won't be looking at you as I read my testimony, but I'm grateful to be able to talk to you tonight. My name is Laura Romney, and I'm a patient with trigeminal neuralgia. It's a facial nerve disease that's often nicknamed the suicide disease because of the intensity of pain that it causes. And I've had this for over 13 years. It's like an ice cream headache that just never goes away. And it's one of the most painful conditions to live with. And about 8 years ago or so, I was in a desperate situation. I had tried everything, over 30 pharmaceuticals. I'd had all the procedures. I even had brain surgery, and I had a stimulator implanted in my face. And I was at a desperation point. And I started looking for alternative solutions because, as you know, in today's society, it's near impossible to get an opioid prescription. The one I was given was very inadequate, and I only was allowed a few hours of pain control per day. So I was just at desperation point when I had heard about Kratom and tried it, and honestly could not believe within about 20 minutes, my pain had dropped from a 7 to 9 level down to about a 2 to 4 level. Mm-hmm. And here I am almost 9 years later, and I consume Kratom every day, and it truly has changed my life. It is an absolute viable solution to the opioid epidemic. And pain patients like me really do need pain control options, especially with the whole opioid crackdown that's been going on. There are patients out there that are being forced to the streets because they literally have no pain control options. And, you hear people say, Kratom saved my life. Well, in my case, it did, and many, many others I know it does as well. I don't crave Kratom. All I crave is the reduction in pain that it gives me. And really, pain patients are really a silent minority in this country. We don't have a lot of voices, and a lot of times we're, hid behind our closed doors because we don't have those pain control options. And honestly, today it was a staggering thing. I'm on a Facebook group called Fentanyl, something about fentanyl deaths. And today I looked, and there are over 37,000 members on that group. And most of them are parents who have lost their children to fentanyl overdoses. And so, as you know, this is the drug culture is a huge problem in our society. And, you start taking away more and more options for people, especially harm reduction options. And people end up going to, other options, which a lot of times can include fentanyl, which, as you know, is deadly. Yeah. Whereas Kratom is very different. It is a partial opioid. It works on your opioid receptors partially, so that it does not suppress your breathing. That is very unlike the 7-OH synthetic products, which I absolutely do not support. Those do need to be taken away from your community. I am one of the people that is in the team, that's the educating team. I know you've been offered the chance to be able to take advantage of that. I highly recommend it. Me just too. Because you will learn so much. I know most of the legislators we speak to don't really understand a lot about Kratom. They have not had the time or the ability to learn about the actual science behind it, and also how you can responsibly regulate in your community. So, we really support the Kratom Consumer Protection Act, which is basically, it talks about age restrictions. It ensures that everything that is sold in your community has great GMP standards, so that everything you're taking is safe. You're not ingesting salmonella and things like that. And again, most importantly, to regulate the synthetics away so that you're not able to have those really truly addictive products on the shelves, which is what a lot of these bad side effects that are being reported are from. Yeah. So again, I just encourage you to follow the advice of the FDA and the Health and Human Services. They're saying ban the synthetic products and leave the natural Kratom products alone. So people like myself and several of the others tonight who have spoken can have access to those products. And again, I highly suggest you reach out to us and take that education and please regulate responsibly, because that's the answer. Thank you again for your time, and I'd be happy to answer any questions you have. Thank you so much.
Yeah, Laura.
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 Okay, moving on to consent agenda. Approval of documents and action items is listed.
What about Dr. Heidi?
Oh,
Oh,
yeah.
I'm sorry, Michael.
Oh,
There's another lady online.
there we go. We can't
I
forget
just
about
forgot
Dr.
to
Heidi.
come on. I didn't do it on purpose. I can't read.
Well, well, can you hear me okay?
Yes.
Yes.
I'm the only one
Okay,
that has that
excellent.
issue.
Yeah, I
Dr.
was hoping
Heidi.
you would not forget me. And I will be brief, but thank you so much, Mayor Stoner and the City Council, for allowing me to speak to you tonight. My name is Dr. Heidi Sikora. I'm a retired nurse practitioner and healthcare executive. I'm from Wakanda, Illinois. During my career, I prescribed and developed quality programs for the most vulnerable patients, including those with brain injuries, frail elderly, and cancer patients. Evaluating and applying evidence-based research to improve outcomes was my specialty. Unfortunately, my career was cut short due to multiple rare congenital painful disorders. Everything in the pharmaceutical toolkit that I was so familiar with led to adverse reactions for me. And I understand that a lot of chronic patients with rare disorders have the same issue. There are not many safe options for treatment of severe chronic pain. My life was limited until I found Kratom. Natural Kratom is not intoxicating. It helps my balance and my driving. For the past 7 years, it has allowed me to enjoy my family, especially our 3 grandchildren, and serve others through volunteering. But I became a Kratom advocate when a close veteran friend tried it for his severe back pain and PTSD from serving our country in the Gulf War. The results were amazing, causing his son to look up at me and say, "Thank you for giving us our daddy back." That is the power of the natural leaf Kratom to heal individuals and families. I have witnessed firsthand the amazing benefits for many others suffering with chronic pain, anxiety, PTSD, opioid addiction, and rare neuromusculoskeletal disorders. There is an abundance of scientific evidence for the efficacy and safety of the natural kratom leaf. And as John Schinholzer said, he's got over 500 studies, and and I think Allison mentioned the ascending dose study that the FDA completed as well. Unfortunately, there are products that have proliferated the market that take that trace but most potent metabolite of the natural plant, chemically synthesize it, concentrate it, and put it in a pill called 7-hydroxymetragenine, or 7-OH. This is not Kratom, but has been marketed as Kratom. So this is what the FDA commissioner, Dr. Makary, called for a ban on these 7-OH products, but he made it very clear when he said, we are not targeting the natural kratom leaf or ground up powder. We are targeting the concentrated synthetic byproduct that is an opioid. So I'm a strong proponent, like everybody else you've heard, of common sense regulation called the Kratom Consumer Protection Act that has been passed in 18 states. And many communities have passed a similar ordinance as well. This regulation ensures safe kratom leaf products are available to those 21 and older, prevents adulteration and concentration with batch lab testing, requires proper preparation using GMP, and labeling according to FDA standards. What I ask you to do is a critical analysis of this issue by asking a few questions. First, have you had any negative reports? And if you have, making sure that the evidence includes a collection and analysis of the actual products reported to have
Yeah.
caused harm. You
Yeah.
will likely find these are not kratom products. Also, for any reported harms, full toxicology reports, including other substances contributing to overdose, because the reports of any kind of kratom alone problem are exceedingly rare, as the FDA has already said. And then the actual number of those claiming harm. Finally, I hope that you will consider the evidence-based education that I offered in my email that I sent to you last week. Many communities have benefited from this education, and no one has ever been harmed by learning more.
Yep.
Thank you so much for allowing me to speak, and I am glad to answer any questions, and I truly appreciate your time.
Yes,
Thank you
Dr.
very
Heidi.
much. Michael Beam.
Thank you. First, I want to say that I appreciate everybody's testimonies on the safe use of Kratom, the natural product. What is being sold in Monticello is not the natural product. It is the synthetic product.
We freaking
I
knew
don't
it.
believe our ordinance outlaws the use of Kratom. It outlaws the sale of Kratom and Kratom products within the city limits of Monticello. I could be wrong, but that's just my understanding. I'm not comfortable being reactionary in any part of my life. I never have been. I've always tried to be proactive, other than housework. Don't ask my wife about that. But we have gone through several meetings up to and including tonight to talk about this, and it's not something that has been just brought up recently and just thrown up here just to try to get something done. Kratom may not be illegal here in Illinois, right? But it is in Wisconsin. It's illegal in Indiana, Alabama, Arkansas, Rhode Island, Louisiana, Vermont, 33 different counties and cities in Mississippi, the entire county of Sarasota in Florida. There are other cities as well, San Diego, Denver, here in Illinois, in Jerseyville, in Kankakee, in Alton, in Godfrey.
It's not illegal in Denver.
Cities up north and a few south.
Rhode Island overturned their ban.
Whether they're making all Kratom products illegal or just the synthetics, I don't know. I don't have the answer to that. But the DEA has listed Kratom as a drug of chemical concern. They even have issued warnings against it. Despite what we've heard this evening, in 2016, for a few months, Kratom was listed as a Schedule I drug. And then folks brought some information forward that apparently changed minds and
Science.
moved things into a different direction. I brought this up to the county government as well a few months ago, and I continue to try to move this forward at a county level. I do understand that it's not sold anywhere else in Piatt County other than here in the city of Monticello. And what's being sold, again, are the synthetics. I know that one of the locations that is selling the stuff told me they are selling a minimum of $1,000 a week of this stuff. They also know that they have people that are likely abusing it. There's people that will come in and buy 3 days worth every day.
Yeah, that's what we hear a lot.
The dangers of addiction to this are real. There are psychological and physiological dependencies to this drug. Perhaps not what the other folks have been kind enough to speak with us about, but for what's being sold here in town, there is.
Get it out.
And stopping people from being able to buy it here in Monticello won't stop it from being in Monticello, right? Don't make that mistake. We obviously know that, right?
If you have the,
It's
like you
illegal
always
to
say, if you have the
sell
power to ban
crystal
it, you have the
meth,
power to regulate
but it
it.
still shows up in Piatt County from time to time, right? People will be able to get it somewhere. But the other part of this ordinance that needs to be considered is the very dangerous Delta 8, Delta 9, and Delta 10 variants, the cannabinoids. Delta 9 is already federally illegal, right? You can't get that anywhere. 8 and 10 were originally illegal as well, but then they got snuck in under a 2018 farm bill. These mostly man-made cannabis
Cannabinoids
items are generally marked and sold as gummies, candies, oils, that kind of thing, right? Toxic to children. A study done back in 2022 by the Journal of Medical Toxicology found that exposure by kids under 18 increased 80% from 2022 to 2023. 33% of those kids exposed were under the age of 6. They see candy, they see gummies, they eat them, they get sick. 58% of all of those exposures were critical care admissions. I would guess that since 2023, those things have only increased just because of the prevalence of this kind of thing in our society now. I do truly appreciate the information that the other folks have shared. And I do understand how it helps in the very specific situations. My question would be, if it is that helpful, why can you not get a prescription for it?
Because it's natural.
People can get prescriptions for medical marijuana. Why not Kratom? And then the second part of this, again, I will remind you, is not making it illegal to use Kratom. It's just simply making it illegal.
I mean, at least that's something.
At
least we're not turning people into fucking
felons
felons.
in a 16,000 person county in central Illinois.
Thank you.
Thanks.
Moving on to ordinance 2025-67.
There we are.
Ordinance prohibiting the sale of the THC products, Kratom, novel psychoactive and synthetic drugs. This goes to Rob, I suppose.
Thank you, Mr. Mayor. This Monticello Police Department responds to calls for service in medical incidents involving individuals that abuse drugs and narcotics. THC products, Kratom, and novel psychoactive and synthetic drugs pose a public health concern. These drugs have not been evaluated or approved by the Food and Drug Administration for use in any circumstance. Some of these items have been marketed towards youth by packaging resembling commonly purchased candy. Individuals have been known to mix Kratom with other drugs or medications, causing them to suffer dangerous and sometimes fatal effects. Pike County Mental Health reports several individuals have been treated for abusing these items locally. These items are currently being sold in 2 gas stations / convenience stores in Monticello. We are working with the Pike County Mental Health Center and Pike County Board to restrict the sale of these items of the city and county. It is recommended that City Council discuss and approve ordinance 2025-67 prohibiting the sale of THC products, Kratom, and novel psychoactive and synthetic drugs.
Any questions or comments for Rob?
I have a question. So how, listening to everyone's stories, how do you differentiate the kratom leaf versus the other synthetic substances? Because, I mean, I understand, you know, that they're probably selling the synthetic version here. But what I hate is that they're all lumped together and that there are people that have legitimate medical issues who,
Yes.
you know, the life-saving stories they talked about. How do you separate that?
So I'll go to, did everyone get the board packet from the FDA from July 29th, 2025?
You can easily separate them.
Page 3, halfway down, how's the FDA protecting the public from the risk of Kratom? There's no FDA-approved Kratom drug products or over-the-counter drugs containing Kratom or its ingredients, metrogyne or 7-OH metrogyne, that are legally on the market in the U.S. The FDA continues to warn consumers not to use Kratom because of the risk of serious adverse effects, including liver toxicity.
That doesn't answer her question.
No.
That's what I go off of. I can agree. Just like Jim and Suzanne mentioned, for every one study you see for one side of the argument, we are seeing another side. I just did a Google search while everyone was speaking.
Oh, hell no.
I found something through the addiction centers called veteransaddiction.org that went and said Kratom is bad. It's known as they call it a substance use disorder.
John's in there.
Yeah, get John up there.
Please reach out, and I get that. Again, there's going to be arguments on both sides of it. I go to the FDA and kind of go with their verbiage on it. Not that I and our illustrious governor have a lot in common. The governor's even looking at some of this, looking at executive order that was just put in the Chicago Tribune 5 days ago. And if Governor Pritzker's looking at doing something along those lines.
Isn't it about 7-OH?
Something we need to look at. And I'll be honest, when the director of the mental health center came to me and said, hey, you know, this is getting to be an issue, I trust Tony. We've seen that in the community. I've seen that at my previous job. You will see people abuse these products, and then we have to deal with the after effects of it.
Maybe you want to, I don't discount the claims that have been made from the individuals that have been touched by the powder or the pure leaf. So I don't want to take away from their testimonies. They're important. I will tell you what's being sold in your community right now is not leaf, it's not powder, it's only synthesized.
Exactly.
I look at
So
it this way
Who's saying that? A
what
board
Officer
member?
Ross just said, the governor's looking at the cannabinoid thing, so we're talking about two totally different things.
I don't know.
You're not removing access from the community. They can still go to a local municipality that doesn't put such a broad restriction on that. There's this thing called
John's
Amazon
looking the other
Days,
way, so it seems like
they
somebody in the
utilize it.
audience.
Just think that
Yeah.
what I am saying as a Monticello resident is you are seeing synthesized kratom being sold, being abused. People are going through some really serious overdoses for that. And so
Not just there.
That's why I brought this to the attention to Officer Ross, to this council, is because I don't want to wait for a fatality to happen before we take action. I think that's why leaders are called, is to look at a much higher elevation, how they can protect their consumers, their constituents. So, yeah, I go to the data, and I will just tell you, to my knowledge, you don't have pure leaf or powder being sold in this community.
That's sad.
But,
Yeah.
but this ban would cover it? I'm just a little bit worried about kind of the legal ambiguity of having this thing cover all these things. And we say like, oh, it's not being sold here, like the natural leaf part, we're only seeing the synthesized, but what you're talking about doesn't differentiate. So it would cover
If you
also the natural?
If you look at the third whereas down on the ordinance, it says Delta 8. I can't even say that word there at all. Also, it's specific to the synthetic. Yes. It's already spoken in that third paragraph down that it's.
Okay, I just saw, I guess,
specific to
Kratom. I didn't
Right,
see like.
but if you go in and actually look at the ordinance, the third
Mhm.
section down.
Okay, that's considering.
Correct me.
As to read it as clear as I'm thinking.
If you read further down, it actually calls out Kratom and then points you to the Kratom Control Act and how Kratom's defined there. And I think it encompasses everything. So it's the opposite of what you're saying. It's not.
Yeah.
It's not defined that way.
You got to differentiate.
Our city attorney did, and then we got a copy of it, I believe, from the city of. You have, again, I'm just factual. So the city of Alton, the city of Elk Grove, the city of Heron, the city of Jerseyville, the city of Marion, the city of Orland Park, and the city of Troy, and now the city of Kankakee have all passed an ordinance that's very similar to what you're looking at, and those are full bans. Now, again, it doesn't mean that you have to follow them. All I'm just educating
You see that
is
too?
it wouldn't be setting any precedent in the state of Illinois. Because there's always communities that have went both ways. What you're looking at now, and maybe something a little bit.
Look, they're
This is the
differentiating.
first step of numbing overdose. I'm going to say it that way.
They're differentiating between Delta 8, 9, 10 versus marijuana.
Yeah.
They can still get that. This is.
Oh, but they wouldn't be able to get it in the.
They could
Monticello.
purchase it within city corporate limits.
Right. And I just keep scrolling down this whole thing, and it's all novel synthetic. I hear what you're saying, because it says Kratom and.
Yeah, as defined in section 5A of the Illinois Kratom Control Act, which if you look up that act, it defines everything.
And doesn't it,
That's cool. You don't have to.
I dove into it while everyone was talking. I want to make sure it was covered, but total paradigm shift when you say you can buy this stuff online. I mean, if people need it, we're not, it's
that crazy?
sold currently. We're not taking away from anybody that's currently getting it locally. They can get it elsewhere.
Couldn't you pass an ordinance too, if you wanted to allow the pure leaf back in, you could just pass it to, do another ordinance to allow that if you wanted to.
We're pretty good at passing ordinances.
Yes.
It's like they're trying to fully ban everything.
Yeah.
To go in there and delineate.
Take the word Kratom out.
This isn't it. Is that manageable?
That's all they
So,
have to do.
Obviously, the first step in this, and this isn't, and I got you, we go in tomorrow, and, take everything off, We
Like
would send a
mirror
letter
the
saying, hey, this is our ordinance,
KCPA
this
and
is what
don't
we
have
passed. We
synthetic,
have 30 days, I think, would be.
semi-synthetic
I know.
708 products on the market, on the shelf.
After 30 days, if we see it, then that's something to where, okay, we look at the ingredients, see how that fits in our ordinance, how it sits with federal and state law, and then go from there. If that means we have to take it out to go testing, then we take it out to testing.
Gotcha.
I have a question for you. So let's say we're a resident of another community that's not Monticello, had the Kratom, let's say the Kratom leaf, and they were pulled over within Monticello city limits.
Mm-hmm.
Would they be charged with having that because is it just banned purchasing of it here? It's not possession.
Purchase. It's sort of like the old adage about cigarettes. It was illegal to sell them to minors, but it wasn't illegal for minors to have them. And that was something that they passed back in, the 70s and then continued on.
I wish they could let us speak.
This is, and obviously things have changed. This is purely for the sale.
Can I ask a question?
Not the possession or anything.
I'd like to ask a question, sir. First off, thank you for your service and all the wonderful things.
There
you
we go,
do.
John.
Yes. Where typically are natural whole leaf
Typically what's happened is with the introduction of the novelty products, the 708 products, a lot of consumers, that's what drives the market. That's what they're buying. So you're right. It's gonna be hard to find a bag of the leaf products locally, but now the purists, we're purists. We're buying them online. They're in bigger cities. They have stores that sell, quality, cheap products. But small communities, the really big issue is, everybody here knows point, you're reacting to misinformation by and large.
So I guess my question is, are you buying the pure leaf at gas stations or general stores?
Two before these other products came and pushed them out in the marketplace. So, but nowadays, most folks, they know a store that sells what they consume or they get them online. That's a big hit. That's a big word, keep possession out of the conversation because, we have, you really want your citizens to have the right to possess and consume a product that's healthy. So you're on point there. And a community this size, like I said, the big issue is freedom and liberties are at risk, and it's a ripple and domino effect across the state. And,
I don't know who this Steve guy is in the
Yeah.
chat, but I love him.
not so much the fake information or the bad information, but you're making healthy decisions. This is a great conversation. I'm really pleased. I drove 12 hours one way to.
He sure did, didn't he?
Yeah, but John loves driving.
Don't even want to have a discussion because they've already made their mind up without getting educated. But it'd be nice if you had somewhere in town where somebody could buy a whole product use, but if people need it, they know about it, they'll get it elsewhere. Thank you so much for asking me a question.
My only comment on this is that there's obviously an effort from the Kratom people, but none of them live here. The only person that lived here that spoke in favor of this ordinance, as did our police chief, as did our mental health director. So I would have hoped that if there was really a need of people in the city
Here we go again.
for this, have it here, that they would have come tonight to speak. And there was nobody that I know of that spoke in favor of the natural Kratom that lived here. Appreciate the information, but they don't represent us.
Of course.
Anyone else?
I understand, dude.
Is there a motion to approve ordinance 2025-67, an ordinance prohibiting the sale of THC products, Kratom, novel psychoactive, and synthetic drugs?
So moved.
Is there a second?
Second.
Any more comments, questions? Hearing or seeing none, they have a roll call.
Good job, Missy. That's a good point.
Mr. Woodham?
Yes.
Mr. Carey?
Yes.
Ms. Lively?
Yes.
Ms. Yoon?
No.
Mr. Burris?
Yes.
Mr. Broderick?
Yes.
Mr. Coon?
Yes.
Motion passes.
One
you.
one person said no.
Moving
I think it
on
was the same lady
to
that was asking
report from
questions.
Fire
Yeah.
Police City Administration Feasibility Committee discussion only.